Hey guys, welcome to yet another Respiratory 2140. I'm sure you guys are probably getting sick of listening to my voice by now. So this video specifically is to cover pulmonary recruitment and secretion mobilization strategies and therapies that we do a lot with floor therapy. So the treatments we are going to be covering in this video are EzPAP, TheraPEP, Acapella, and incentive spirometry. As with all treatments, you make sure you assess your patient, you have the proper patient, wash your hands, and gather your equipment. The first one we are going to go over is the EzPAP. This is the only one that you need an additional gas source, such with our flow meter and our nipple nut adapter. While the other ones work independently and you don't need a gas source. So this is the EzPAP. This is the mouthpiece. It can come off and you can attach it to a cushion mask, such as on an ambu bag, if you have a patient that is unable to use the mouthpiece. Otherwise it fits right here. Then you'll see there are two adapters, two ports here. This is the manometer. This measures the pressure which the patient is able to provide when they use this piece of equipment. It attaches right here. The second port right here attaches to oxygen for our gas source, which provides pressure. And then this end is exhalation. So you can use the EzPAP in three different situations. You can use it as a mouthpiece. You can use it with a cushion mask that you hold pressure against the patient's face and they breathe against it. Or you can attach it to a trach if you have a patient with a trach that needs secretion mobilization and pulmonary recruitment. So it's a pretty versatile piece of equipment, and the physiology of how and why it works is as your patient breathes against something, think about if you were to blow up a balloon that hasn't been stretched out yet. That additional pressure, that back pressure, pushing against something helps to bring those secretions up to the main airways that can be coughed up and out, and also that back pressure helps to recruit the lungs by popping those alveoli open. You will then take the other end and attach it to your flow meter. So the lower the flow, the more difficult it is for the patient to exhale against this pressure. So if you go up to 15, the easier it is. Typically, you go by the rules of 5. So 15 would be the easiest. Your patient would be able to exhale easily. Most of the time, I run the therapies on 10 liters. It's kind of the middle ground. Patients are able to breathe against it, but not tire out, but also have it be beneficial. And then 5 liters is the lowest if you have someone that's just doing really, really well. On the manometer, you can see there are green and yellow ranges, but specifically there is this elastic here, which you can set to where your patient is at, where they're doing, so that they can have that goal to reach here with this red line as they exhale, and try to beat their own personal goal. Typically, after I do my assessment, I have a patient do 3 sets of 15 breaths. 3 sets of 15 breaths. So I have them exhale 15 times into the EzPAP. Then I tell them to take an easy breath and cough for me. That cough is important because it helps with moving those secretions up and out. So 15 breaths, cough. 15 breaths, cough. 15 breaths, cough. The cough is really important. I'm just going to emphasize that again, that the cough is important, and have your patient cough. So that is the EzPAP. We'll have you guys practice on. Next is its cousin or brother, however you want to call it, the TheraPEP. It does the exact same therapy. Your patient will breathe against it. It will help move those secretions up and help with pulmonary recruitment. A few things I'm going to show you guys is we have the mouthpiece, which can come off. Most of the time, TheraPEP is used on mouthpiece patients that are easy to work, that don't have advanced airways. Most of the time, if I am using this on a trach patient, I would use the EzPAP. But if you have a patient that maybe has some trauma, you can use the TheraPEP with a mask also, but most of the time it's indicated with the mouthpiece. Down here, it's probably hard to see on the video, but when you guys get in lab, make sure you see there is an arrow and these numbers. The higher the number, the more work the patient has to use. So the higher the number, the more difficult the pressure is, or more forceful the pressure is to help with that pulmonary recruitment. Next, we have our gauge here down to the PEP area. So when a patient exhales, there is a blue dial that will go up. You want to try to have the patient get that dial between the two black lines the best they can. This helps them to control their breathing and get a proper pressure on that exhalation to help with pulmonary recruitment. One trick I always tell patients is this kind of looks like a birthday cake, so blow out like you're blowing candles out on your birthday cake. So just as with the EzPAP, 3 sets of 15 breaths. So 15 breaths, cough, 15 breaths, cough, 15 breaths, cough. Make sure you assess the strength of their cough and if they cough anything up, the consistency. So that is the TheraPEP. Sometimes it takes more coaching, but it's a great piece of equipment and patients can use this on their own whenever they want. You can leave it at the bedside and have them practice on the TheraPEP. Next is the Acapella. So the Acapella can be used for pulmonary recruitment, but more specifically, this is used for secretion mobilization and breaking up of consolidation. So we have the mouthpiece here. It can also be removed, but again, most commonly it is used with the mouthpiece, just as with the TheraPEP. So what it does is on the inside here, when the patient exhales, it makes a vibratory mechanism. And in the back, again, you can adjust the sensitivity or the pressure you're delivering. The higher the number, the more powerful the force is with vibrating the thoracic on the inside. So the patient will exhale and we can adjust, make it a higher pressure based on that. Have the patient exhale, and I'll just do it so you guys can hear it. That vibratory sound causes vibration in the chest, which helps to break up secretions and mobilize. This is commonly used for cystic fibrosis patients, but I've also used this on pneumonia patients that are pretty stable. That might just need some oxygen and need help with recruiting their lungs and secretion mobilization. It's a good piece of equipment. Another thing that's really nice is it can be used in any position, which is very nice if you have a patient in bed. The last one is the incentive spirometer. You guys are going to be doing a lot of these. This most commonly is ordered after a surgery so that patients are continuing to take deep breaths while they're resting in bed. It helps prevent pneumonia and atelectasis and helps keep those lungs inflated and healthy and in good condition. So you can see these markings over here are in milliliters. This piece here can be moved up and down so a patient can set a goal, and the patient can set their goal and give them time to volume to beat. This is just a nice handle. Over here you can see it has best, better, good. You want to try to have your patient get into the better range while they inhale so that they are getting the appropriate flow while taking that breath in. And finally, we have the hose and the mouthpiece. So when I instruct patients, I tell them just pretend like you're taking a nice big deep yoga breath. So have them put their mouth on and take a deep breath in as deep as they can. Hold it and exhale. And it is appropriate to have a patient exhale into their incentive spirometer. That is appropriate. Mark their highest place where they reached and have them continue to do it. Most facilities in this area have patients do 10 deep breaths, so 10 of those every hour while they're awake. So get plenty of sleep at night. I always tell them to do it during commercials. So if they're watching a show on TV, they're resting, they're recovering from their surgery. Once the commercial hits, do their 10 breaths and they're good for that hour. Another thing is if a patient exhales and takes that big deep breath in to peak inhalation, that is a non-invasive way to measure a patient's vital capacity, which for bedside PFTs might be ordered. If you, for some reason, need to order a patient needs a vital capacity performed, you can perform it on an incentive spirometer. So the patient will just take a deep breath in, and that will be the volume from exhalation to peak inhalation. All right, so that is the IS, the EzPAP, the TheraPEP, and the Acapella. I will have these here in lab for you guys to practice on. Make sure to ask lots of questions, get involved, and get lots of practice going. Okay, thanks so much, guys.